Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbambu.com. So today we're going to discuss a topic that was requested by one of our Bambu followers. They were asking about information and help with toilet issues, specifically related to frequent trips to the toilet and long sitting times. Before we get started, I do want to let you all know that we have a toileting and hygiene mini course coming out soon, and as a part of that mini course, one of the many parts of the mini course, we will be discussing how to address other challenging toileting behaviors, such as not using the toilet, peeing in odd places or missing the toilet, refusing to sit down on the toilet, not wiping themselves, clogging the toilet with toilet paper or incontinence products, refusing to wear or change incontinence wear, fecal smearing or picking poop out of the toilet, and hiding soiled clothing. So if you are interested in this mini course topic, I strongly recommend that you join our newsletter to be notified when it's available because it will be available soon. You can also check the podcast notes and I will post a notification when it's live as well, as you may discover this episode after it's already out. So let's go ahead and get back into today's topic, how to address frequent trips to the toilet and long sitting times. So first things first is we always want to take note of when this behavior started. Is this a new behavior or is this habitual and something that is unique to the person? For example, before going to bed, I may get up to go pee 4 or 5 times before I finally fall asleep. I'm talking like every 5 minutes or less. It's pretty ridiculous. It's something that I accidentally conditioned myself to do when I was younger, and now it's a hard habit to break because the sensation to pee is there until I fall asleep quick enough. I also have this issue right before I leave the house. I'm also a person who will naturally sit on the toilet for a long time during the day if I'm not in a rush for anything. It doesn't matter if I'm just peeing or if I have to go number 2. So if someone were to observe this behavior in me, there would be no real reason for concern because this is just what I do and how I am. Does that make sense? However, if this is a new behavior for your partner and it seems out of character, then we want to know, well, when did this start and what is the frequency of the behavior? Is this every single day or just a few times a week? When they go to the bathroom and sit there for long periods of time, do they actually use the bathroom or are they just sitting there the whole time and the toilet remains empty? This is why I always recommend using a journal or a behavior tracker, which we actually do have one available inside the treehouse at letsbambu.com/treehouse, so that you can track behavior and pick up on patterns to better determine what may be going on. So let's say that this is a relatively new behavior and it's happening almost every day. Well, the first thing we want to rule out is a UTI or constipation. Both of these can cause the frequent urge to urinate, and of course, if your partner is constipated, it may result in sitting on the toilet for long periods of times as well, with not much result, right? Now, if it's not really a new behavior, but you've noticed changes in your partner's bathroom habits over time, another thing that we want to take into consideration is, does your partner have an overactive bladder? Or 2, could they have possibly conditioned themselves to feel the need to use the bathroom frequently, kind of like I did? A lot of times this happens because they feel the sensation of needing to use the bathroom and fear having an accident, or maybe they've even already had an accident and that's what exacerbated the behavior of frequently going to the bathroom. Again, this is why it's so important to observe and track the behavior because it can be so different for everyone. Now, before I provide some suggestions for things you can try, let's first dive into why someone would sit on the toilet for a long period of time. So, as we've already discussed, it could be due to constipation. It could be habitual, meaning it's just something they do. But what could be some other reasons? Well, with dementia, it's very easy to lose track of time, right? So the person may not realize how long they are actually staying on the toilet. Others may feel the sensation of needing to go for one reason or another. Could be related to a UTI, could be due to urine retention, which means the bladder isn't emptying fully. It could be a conditioned response, it could be something else, but it keeps them on the toilet because they are waiting for an output or for the sensation to go away because maybe it just feels like it can't be relieved and nothing is really happening. Could be nothing at all is happening, or it could just be little squirts, right? And then, two other big reasons that I'll quickly mention is that the person could have what's referred to as a shy bladder or shy bowel, where a person is unable to urinate in the real or imaginary presence of others. So, if you are standing in the bathroom with them because they need help using the bathroom, this could be a reason why it takes them so long. If they are misperceiving what they are seeing in the mirror as someone else, they may have a hard time going as well. So, if you think this may be the reason, step out and give them some privacy. Maybe run some water if you think that will help. Crack the door a little bit if you need to so you can still see what's going on. If the mirror may be the culprit, use something like adhesive paper curtains and cover it up, okay? And then the second other big reason is that they may have a hard time terminating the task and sequencing the next steps. When am I actually finished and what do I do next? It's that type of thing. So it's possible that your partner may need more help in the bathroom, okay? So, as you can see, there can be a lot of reasons behind frequently going to the bathroom and sitting on the toilet for long periods of time. And there's even more that we haven't talked about. So, the reason will be different for each person, and you'll have to do a little investigation and digging to figure out which reason or reasons apply to your person. With that being said, let me say this, and then I'll give you some general tips you can try. So, if medical reasons like infections, bladder issues, constipation, prostate issues, etc., have been ruled out, I will say that this behavior in and of itself is typically not a big deal unless they are wearing themselves out by constantly walking back and forth to the bathroom, causing themselves distress, causing themselves pain, or have trouble standing and walking after sitting on the toilet for so long, putting them at an increased risk for falls, okay? So, if there's no underlying medical things going on and it's not really causing a problem for them, sometimes you have to just choose your battles and let them be, okay? Does that make sense? But let's go ahead and talk about some strategies to address the behavior of frequently going to the bathroom and sitting for long periods of time. So let's see, I'll give you three, and keep in mind that the appropriateness and effectiveness of the strategy depends on the reason behind the behavior. That's so important to understand, okay? So, number one, if the issue is primarily with sitting on the toilet for long periods of time, you can try using a timer to help manage this behavior. For example, you can set it for 5 to 10 minutes or whatever would be an appropriate duration for your partner. You can even encourage them to set it for themselves if they are open. And when the timer goes off, you can check on them to see if they need assistance, or it can be a cue for them that, hey, it's time to get off this toilet. You may even need a sign that tells them what to do when the timer goes off. For example, when the timer beeps, I will wipe myself and leave the bathroom. Now, if your partner doesn't naturally wash their hands after using the bathroom, then the sign may need to say something else, or there may need to be an additional cue in the bathroom, right? Number two is implement a toileting schedule. So, a toileting schedule is when you have the person use the bathroom at regular scheduled intervals. So, this is typically every 2 to 4 hours or based on your partner's natural bathroom habits. However, in this particular case, you may want to start with shorter intervals, like every 60 to 90 minutes. This may be more effective depending on their usual frequency and make for a potentially smoother transition. Now, the question is, well, if they're constantly going to the bathroom every time I turn around, how am I possibly going to get them to wait an hour or 90 minutes before going to the bathroom? And the answer is distraction. When people are preoccupied with activity, they pay less attention to things like bodily sensations. An activity could literally be anything, and it doesn't necessarily have to be structured. For example, you could have them help you with something around the house, like cooking, cleaning, organizing something, etc. Just give them something to do to help them pay less attention to the fact that it feels like they need to use the bathroom, okay? Now, what I will say though is that at any time during an activity, if your partner insists that, hey, I have to go to the bathroom, please do not stop them from going to the bathroom. Because if your partner does have an accident because you kept them from going to the bathroom, it's only going to make the situation worse, okay? And then number 3 is make sure they are staying hydrated and taking enough fiber and remaining active, meaning moving their body in some way. That way, if actually being able to use the bathroom is an issue and that's why they sit so long, they may actually be able to do what they need to do when the time comes. And also, please keep in mind that your partner may need some assist in the bathroom. Maybe they even need a verbal cue to push or something like that. Again, everyone's needs are different, so we have to grade our approach and support accordingly, okay? But I really do hope that this was helpful. If you have any specific questions, comments, or future podcast requests, you can send us an email at podcast@whatthedementia.com or contact us through letsbamboo.com. And then apparently you can even leave comments now if you are listening to this on Spotify, so you can also give that a try. But thank you so much for joining us on another episode of What the Dementia by Bamboo Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bamboo Care is always here.